Everybody ready? Okay. Thank you for joining us today. The purpose of today's meeting, or today's press conference with Dr. Eckstadt and myself, is really to focus on two things. One, how the expansion of Medicaid will have an impact on hospitals and providers, and also how the expansion of Medicaid can save us some money in the state. So I'd like to ask Dr. Eckstadt to come up, and then afterward I will follow up on some comments on expansion of Medicaid for the state. Steve?
Good morning. Uncompensated care is medical care that is given to someone who cannot pay for it. Much of this is in the form of charity, and the rest is inability to pay or bad debt. According to the Iowa Hospital Association, Iowa hospitals provided more than $850 million in uncompensated care in 2010, which is the last year we have data for. The underlying cause of this uncompensated care is lack of insurance. Some 80% of individuals without health insurance belong to working families who either make a bit too much for government assistance or work part-time, or for employers who do not provide health care coverage for their workers. They're unable to afford the high cost of private health insurance and therefore go without in fear of the next injury or illness to befall their family. The cost of this care, given but not paid for, is covered by those of us with health insurance, and this cost shifting increases our premiums. Expansion of the Medicaid program would provide health care insurance to millions of Americans who desperately need it, while at the same time lowering the cost of health coverage for those of us fortunate enough to have insurance. Being uninsured also leads to a lack of preventive care and delayed care, which dramatically escalates the cost to the nation. A recent visit by a patient to one of our free clinics is illustrative. I saw this gentleman, who's 35 years old. He came to one of our free clinics because his younger brother, note he's 35, his younger brother, had a stroke. Both men have full-time, minimum wage jobs, but neither one of them have health insurance. Both men have been aware of the fact that they have had severe hypertension for quite some time, but neither could afford to see a doctor or buy medication. The gentleman who came to the free clinic will luckily receive basic care and medications and hopefully avoid a stroke or death due to his severe hypertension. His brother, on the other hand, will suffer the consequences of his stroke and an overwhelming medical debt that will undoubtedly become part of that $850 million in uncompensated care here in Iowa.
Thank you, Dr. Eckstadt. The emphasis on uncompensated care comes basically from those individuals that are eligible for Medicaid but are not enrolled. And the governor's insistence that he is not going to consider the expansion of Medicaid through the Affordable Care Act is not only troubling to us who have been working on policy and knowing the effects that this will have on individuals, but you just heard from Dr. Eckstadt, and you saw the figures from the Iowa Hospital Association that said, boy, this is expensive too. So the idea of participating in the expansion of Medicaid has a direct effect on our general fund. The governor and I agree with that. The difference is he thinks it's going to be a burden, and I think it's going to be an asset. And one of the reports that I have for you, it's a major think tank, the Urban Institute, came out with a report just last year that said the expansion of Medicaid could save states money. Specifically, they gave 3 reasons why this would be an asset to states to participate in the expansion of Medicaid. 1, many patients currently receiving services with a significant matching share from the state will now have their costs entirely paid for by the feds. 2, significant number of mental health patients would be covered under Medicaid or private insurance, creating savings that the states have incurred on their own. And this is particularly true in Iowa since we just had a major mental health reform package. The dollars are staggering, and the commitment that this state has already made to mental health can only be accomplished if we expand Medicaid. That was always part of our deliberations. That was always part of our understanding that in order to fund the mental health services that we just passed, expansion of Medicaid and the Affordable Care Act was going to be essential. And three, you just heard from Dr. Eckstadt that the large number of uninsured Iowans would decrease, and the costs associated with uncompensated care would also decrease. If we don't opt in, federal money will be spent elsewhere. It's not like we're going to save the Treasury of the United States. Other states will take that money. The concern that someday the feds, and this is what Governor Branstad has said several times, that you can't trust the federal government. Well, that's more political than substantive. And if that ever did happen, then all we would have to do as a state would be to adjust our Medicaid waiver program and adjust for the lack of federal money. If that has to be done, that is within our purview, and it's our responsibility to do that. And three, one of the biggest providers of uncompensated care is the University of Iowa hospitals and clinics. An extraordinary amount of funding would be saved in just that hospital system alone for this state. The second report I gave you, which is here, goes to the fact that after all is said and done, the second page of this report is really telling, and it's the third paragraph, and I have it in my press release, that we're anticipating that there will be 80,000 Iowans who would be eligible for expanded Medicaid that would be dropped from any consideration if Governor Branstad does not expand Medicaid. Those are people with 100% or below of poverty. These are the people who Dr. Eckstadt just talked about. Other people above 100% would probably get on private insurance through the exchange. So the 80,000 number is really significant. And basically, the report goes on to say, these uninsured adults would not receive any additional help obtaining health insurance coverage under the ACA if their state does not expand its Medicaid program. So we just have to understand that if the governor does not expand Medicaid, he is consciously leaving out 80,000 Iowans that would be eligible under the federal health care plan to receive health insurance. With that, Dr. Eckstadt and I would be glad to answer any questions.
You were quoted in an editorial yesterday in the Register.
Yes.
Talking about Iowa Care. Can you talk about that program and what the implications are going to be?
Sure. Iowa Care is Iowa's version of expanded Medicaid. It is geared toward those people who are not eligible under the present system, adults, these are uninsured adults, up to 200% of poverty. Right now we have 72,000 Iowans engaged in that Iowa Care program. They get a basic health insurance. It's not very good, but it's something. It's statewide. It's what we used to call the state papers program, where everyone who was, every adult under 200% of poverty would go to the University of Iowa. Well, Iowa Care expanded that to include broad lawns. And now, just 2 years ago, we expanded that to include the community health centers. So individuals can get preventive care at the 14 community health centers across the state. It's not adequate, but it's acceptable in lieu of they would get nothing else. Though that program expires in 2014, the same year that expanded Medicaid has to go into effect. With the Affordable Care Act, I'm getting a little bit in the weeds here, but you'll be hearing this over and over again. You've heard of the insurance exchanges. The insurance exchanges is a network that is required now by the federal government. That's what your individual mandate was all about. Some of those Iowa Care patients will be able to obtain insurance through the insurance exchange network because it has the ability to subsidize some of their premiums. Others won't. So what you have is the 80,000 Iowans. That's how we got there.
Do you foresee the governor sticks to what he said? Do you foresee a legislative effort to renew Iowa Care for another
Well, the Iowa Care Program was established in a bipartisan legislative session. Well, the Republicans controlled the House, and we controlled, along with and it was split in the Senate. I would think that the legislature would certainly propose two things. We will propose expanded Medicaid if the Democrats still control the Senate. We just feel we have that obligation. We don't want to do it. The whole point of this is we don't want to do it alone. We need participation. We need the governor's participation. We need the executive branch participation. We need the stakeholders' participation. Iowa will not roll over and just not attempt to try to expand Medicaid. We have an obligation to those thousands of Iowans, their families, and employers as well.
Can you talk about the absolute moral failure that you talked about when you prepared this draft national decision? Would the governor, do you think, reject the fact that it's government's job to take care of all these people? Or how would you back that?
Well, today we're talking about the economic implications, and I think Dr. Eckstadt made it very clear in the Iowa Hospital Association in its figures of uncompensated care. Part of that uncompensated care is what is determined as charity care that we give to somebody. There is a moral obligation as a society to provide care. Some of us believe it's a right to receive health care. Others think it's a privilege. Those of us that believe it's a right fall on the side that we have to do everything we can to secure health care services to everybody. We're doing some of that now, but with the Affordable Care Act, I think it establishes the economic basis for us to do it for everybody. And then I believe those like Iowa Mercy Network and hospitals that believe that they have a moral obligation, I think the state feels that we should have a moral obligation too. And to purposely not accept that as part of the discussion, I think falls short of what government and private enterprise can do together.
Would your hand be strengthened if today the Iowa Hospital Association and insurance companies were here making this argument with you, since many sort of talks? Their silence on this doesn't help your position.
Well, I think the fact that Dr. Eckstadt is here is the beginning of that conversation, that the hospitals do have a lot to lose, and at the same time, they know that this is a great opportunity. I also, and I'll just be frank, I think the fact that the governor has stated that he does not want to expand Medicaid has put a lot of stakeholders in an awkward position. I'm sure they're thinking, well, we don't want to go up against the governor, but also we can't let this opportunity pass us by without a thorough, open discussion. And I think that the hospitals and other stakeholders are going to begin to be a little bit more public in this discussion.
The governor says this is unaffordable and unsustainable, and it's going to take an election to decide this. He wants to wait to see what that
What he's doing is putting this whole issue of economics of affordable care and the access to affordable care in a political environment, which we should not do. The politics has been decided. It passed the Congress, it passed the Supreme Court. It's time for us to move forward. It is time for us to put politics aside. If he thinks it's going to cost the state, well, have him come forward and give us those numbers. We've brought forward numbers today that, and nonpartisan think tanks across this country saying this is a good thing for states to participate in. There are obligations that states have to worry about. We're willing to look at those, of course. There are some consequences that are particular to every state that we should be discussing. But we shouldn't do it blindly, which is what he's suggesting. After November is the worst time to talk about this. It's taking it out of the political arena. That's why the stakeholders, the hospitals, the providers, the consumers all have to be involved, and we should do it in a sense where we have some bipartisan, or now what I think is more important, nonpartisan leadership to assemble its stakeholders to come together.
Are you still planning on having your forum where you're supposing you the governor and Speaker of the House said that they're not interested in that?
Yeah, they're not interested in hosting it. There are other stakeholders that understand the need to have it, and we're pursuing that now.
You don't have anything set?
No, nothing yet. And if we do it, the politicians will be taking a second row. We're not going to be up front. We really want the stakeholders to come forward and say, listen, this is our obligation. This is about serving and providing care to our patients. And if the politicians are into can't agree, then maybe we should do something on our own. Okay, I think you have another place to go. Thank you.